Hi, everybody. Thanks for joining us today. We're going to get started here in a couple minutes, but I just wanted to chime in and see, please add to the questions tab in your GoToWebinar panel. Just let me know if you can hear me all right, and we'll make any changes we need to, and then we'll get started here in a couple minutes. So thanks again for joining, everybody.
Hey, everybody. Good afternoon. My name is Dave. Really appreciate everybody taking the time and jumping on the webinar today. We have a really good one. Today's topic is using healthcare data analytics to connect HR and compliance. So this is actually one of our higher attended ones of the year as we close out our monthly cadence with these. We're really excited about some of the data we have for you today. So really appreciate your time. Before we go ahead and get rolling, a couple housekeeping things. First, you'll notice in your GoToWebinar panel that pops up the ability to ask questions. Please feel free to ask questions along the way. We try every single time to address as many of them as possible. Regardless of what your question is or what's kind of on your mind, type them as you go, and we'll try our best to get to them throughout the presentation. So please fire away. We'd love for this to be as engaging as possible and for you guys to max your value for jumping on today's call. Secondly, you will be receiving three things following the webinar today. You'll be receiving a copy of the slides, so you have them as a free resource to go ahead and leverage as you build out your strategies for next year. You'll receive a recording of today's webinar as well that you can certainly share with your team or go back and listen to. And you will receive, for those that are attending today's session, CEUs for your time. So again, no charge for any of that. So again, with that, we'll go ahead and kick it off. Today's presentation will be delivered by myself. My name is Dave Servadidio. I lead our marketing efforts at Provider Trust, and Donna Thiel, who is our Chief Compliance Officer at Provider Trust as well, after a really experienced career in the post-acute world. A little bit about us before we go ahead and get rolling. We're Provider Trust. We like to say we're made with love in Nashville, delivering compliance solutions from healthcare's capital. What we do is pretty simple, right? We're a vendor that works with health systems, clinics, health plans, in the acute and post-acute world on the health system side, to do a lot of different things. We're focused on ongoing healthcare license, certification, sanction, and exclusion monitoring for employees, for vendors, for provider networks, and the like. We have a suite and a platform of software as a service products that we like to say are flexible and adaptive to unique needs of our clients. We deliver real-time accessible data, and we're committed to providing freedom from process so that we can all focus a little bit more on people. Really, in a nutshell, we're in this every day. We're in the compliance space every day. We're in the healthcare data space every day. It is what we do. So when we started putting on these webinars, we realized we just had a natural synergy in being able to provide insights to the marketplace and to our friends, just in terms of what we're seeing and what the industry is telling us. So excited for some of the stuff we'll be able to share with you today. Donna, go ahead and take it away, and let's go through the agenda.
Awesome. Thank you. And welcome, everyone. Thanks again for joining us this month. We really do appreciate having you with us each and every month. So today we're going to build off of the webinar that we did last month. So for those of you who were with us last month, we just received some really great feedback, and we want to continue to build off of the importance of the compliance and HR relationship. For those of you that missed last month, no worries. You don't have to have that information in order to make this a valuable hour for you. But we're going to build today off of that relationship. So we're going to start with why a relationship or collaboration is essential between compliance and human resources. Then we're going to talk about some of the pain points and the risks of what we call bad data. So we're going to talk today about people data and good and bad data. Then we're going to share some information, and we're going to talk about some of that shared information and functionality between HR and compliance. And then we're going to talk about how to design an effective data monitoring strategy. And at the end, we're going to share some steps to build off of after our session today. So hopefully you'll find this hour valuable to you. So let's get moving with our presentation today. So why is compliance and HR collaboration so essential? Let's start with a polling question and just tease just a tish before we get into our session today. So we always like to have a better idea of who's joining us. So share a little bit about yourself. Which department do you work in at your organization? Are you part of HR, procurement, the legal or risk department, compliance, or somebody, another department? And if you're in one of those other departments, feel free to type in the question box which department you're in. Then it gives us just a little bit more information. So we'll wait for another second or two, and then we'll close. All right. So as it looks like a bulk of our people joining us today are from compliance and 21% from HR. So we're super excited to see our HR folks joining us today. And then the other will look as we go through and see who some of our other people are. So let's go ahead and move on. So first and foremost, why is HR and compliance so important? In my mind, right, it's just a natural partnership. Everything that happens relative to our people, our team members, our employees, all those issues that we deal with on a routine basis, they really require HR and compliance expertise. So the two teams need to collaborate together. And really, everyone involves both people, and we involve people and we affect people. So it just seems like kind of a peanut butter and jelly sort of relationship, just a natural partnership. So let's move on and look at some of the areas where we may see a little bit of siloed activity for our own two departments, and then where we collaborate. So from a human resources HR perspective, right, we kind of think about that team in that payroll and benefits. They recruit a lot of folks for us, monitor or do a lot of training, certainly manage the onboarding process, very involved in helping keep our team members, retaining all of our quality staff. And then the unfortunate part, right, of managing that disciplinary action component. And then when you look at compliance has a few hats that they wear as well. They certainly have a responsibility to manage the regulatory world, keeping people focused on new updates or informed about new updates that come about. They may not own policies and procedures, but certainly have a role in monitoring and making sure that policies and procedures are consistent with all of the regulations. Certainly participate in audits, whether that's directing them, taking the information that are received through the audits, following up on it, creating the code of conduct, sharing that important information with the organization. And then they also have to report any negative or concerning information to any federal or state entities. They're always involved in risk assessments, right? Always trying to figure out why things are happening, what's happening, how we can make them better. And our friend HIPAA, we didn't want to leave that out. And then what are some of those areas where the two teams collaborate? Those kind of fall right in the middle of the box that we're looking at. So certainly something that's familiar in our provider trust world, the license management, the exclusion monitoring, but also the hotline investigations, right? If we get a hotline call, typically who's involved right away and helping us delve into that? That's the HR folks, right? Really going in and looking at what's happening. making sure that we're doing things on a consistent basis. As we're having disciplinary actions, are they consistent across our organization, between departments? Are we implementing disciplinary actions in a fair and consistent fashion? And then also retaliation investigations. We certainly all have what we would consider, retaliation-free, non-retaliation organizations. But unfortunately, those allegations happen, and HR and compliance are both very involved in completing those investigations. So the next area I want to cover is something that when we put our slides together and our presentation together last month, this was kind of an aha moment for me. I grew up in the compliance side, so we always focus on the 7 elements of the compliance program. But when I was really looking at these 7 elements, it was so obvious to me how many of these areas are actually joint relationships or joint responsibilities between HR and compliance. So I just wanted to share the slide again this month just to highlight the fact that there are so many areas that compliance focuses on that also have direct correlations to HR. So the first one the first element is policies and procedures, and the requirement to have policies and procedures. And one really important thing that our HR folks pull together for us is our employee handbook. We have all sorts of policies and procedures and compliance information and behavior information in our employee handbook. I won't go through each and every one of them because I think we all know the 7 elements, but maybe looking at monitoring and auditing, understanding how HR audits and our new hire compliance process is so important between both departments. We know that there are a number of state and federal regulations surrounding new hire practices. So from a compliance perspective, right, we're always looking to HR to say, hey, did you do the right thing? Did we check all the boxes on the new hire process? And then number 7, when we're looking at response and prevention, our hotline calls many times relate to HR issues that our staff or our team members are bringing forward. So a very important part of collaboration between HR and compliance falls under number 7 and certainly within our hotlines.
Well said, Donna. Moving to the next section and really getting into some of the meat of what today's topic is looking at specific pain points and the risks of bad data. And what do we mean by bad data, right? So what does that look like? Let's anchor to kind of what we see on an ongoing basis, which causes a lot of the pain as a result to bad data in the compliance and HR world. On the next slide, you'll see what we're talking about when we say people data. You'll hear us say this phrase several times today. What we're talking about in a nutshell is just basic demographic information. And is there a standard process for making sure you have basic demographic information for all of your employees or various population groups if you have a referring network of physicians or therapists or whatever it might be. This may seem very, very elementary. You all would not believe how many clients that we see or organizations that we see that don't have a standard process for collecting all of the things you see right on the screen, right? So current name, any former names of an associated employee, social security numbers, NPIs, if applicable, date of birth, address, and any and all license or certifications, right? The numbers, the expiration dates, the validity of those. Y'all would not believe how hard that may actually be as your organization starts to scale. Looking at this a little bit deeper then, right? If that's what we say is baseline for people data, let's look at what we would say is other people data, sort of part 2 of this, which is really specific to y'all's organizations. Job codes, application access, background checks, unique personal identifiers, locations, any sort of testing or drug screening results, LCR, dates or any of the actual artifacts associated with licenses, certification renewal, training requirements, or annual reviews, right? So where is that stored? Where is that warehouse? That's sort of what we would refer to as phase 2 of people data. Really, it's as you guys can relate on the phone, there's a lot. That's a lot of data points that we're talking about with people, right? There is so much data, so many changes as you see on the screen. So part 1 of that is there's a lot of things to collect. Part 2 of that is that all the things you're collecting, most of the things you're collecting require updating on a pretty consistent basis. So finding a process to actually keep those standardized each of our organizations evolves, turns out to be a pretty big problem pretty quickly. So Don is going to show you a quick example of what happens if we collect all the right data, but even if something updates along the way and we don't catch it, kind of what's an example of a real life example of the impact of change?
Thanks, Dave. So this is an example of an actual client of ours who had this situation. So this is related to a nurse. I think we can everyone on this call has a number of nurses, I'm sure, on your staff. So this story starts in June of 2016, where there was an allegation of theft of money from a patient. It was an allegation that was then shared with a licensing board. The licensing board took a year, right? We know a lot of these things do not happen quickly. And in June of 2017, the licensing board issued an administrative action against the person, right? Against this particular nurse. That nurse had the opportunity to defend themselves, but they did not provide any defense. And so at that point in time, the board revoked the license. We also know that the OIG has the ability to exclude someone based on a license revocation. So then 6 months later, in January of 2018, the OIG excluded this nurse based on the license revocation that had happened the previous year. The SAM.gov, typically follows what the OIG does. So that same month, SAM excluded the person based on the OIG exclusion. Now, somewhere between January of 2018 and May of 2018, the employee changed their name. So in 2018, a new healthcare provider hires this person. They go out, they do the right thing, they go to the OIG site, they type in the name of the employee based on the name that the employee has now provided to them, and there's no match. Because why, right? The name changed. And we know when we go into the OIG site, you type in a name. So then in May of 2018, the client uploads their new hire information into our provider trust database, and we actually found the exclusion immediately. And we returned to we gave to our client the fact that this person indeed was excluded because they had a former name that the exclusion was under. And so therefore the employee was terminated. So this is just a real world example of how important it is and how difficult it is to manage all of the changes in our environment. So let's move on to the next polling question. So based on Dave's sharing of kind of what we're calling people data, how confident are you that you have accurate people data within your variety of systems? 3 choices: not confident at all, somewhat confident, or very confident. So Matt, we'll just give it a couple more seconds, see how everyone's feeling about that. All right. Well, I'm not surprised. Somewhat confident, 64%, very confident, 32%, and not confident, 4%. So the kind of the majority, if you will, is somewhat confident. And I think that's how many of us would feel at this point in time, right? We have an awful lot of data, and it's really difficult to feel confident with 100% certainty on all of our data. So let's keep moving. So this is a slide, and this talks about something that we call should have and do have. So when you're talking about the variety of licenses and certifications and requirements that you decide a particular employee must have, we call those should have. So we say as a healthcare organization, a nurse in our company must have a valid RN license or an LPN license. We want them to have basic life support certification. Maybe it's a wound care specialist, so we want them to have some sort of a certification regarding wound care specialty. Those are what we say you should have. And what we find, though, is that even though the organization documents what should have, we don't always really have the ability to go out and track the do haves. So that creates a big gap between what we think someone has and what they actually have. So one of the things that creates risk to your organization and challenges is making sure that you know what you should have and that you actually, your staff has what you want them to have. So let's look at a real life example of that. So we brought on a client who we assisted them with just doing an initial license verification of 8,000 of their licensed professionals. So of the 8,000, over 1,000, 13% had right off the bat, day one, significant issues with the licenses that they gave us. First and foremost, 61%, we weren't even able to verify the license based on the information that they shared with us. Now, keep in mind, our database has all sorts of extra things. So we know that a social security number is tied to a person, that Donna Mawson and Donna Thiel are the same person, all sorts of things we have in our database. But even with as strong as our database was, we still had 61% of their folks that we were not able to verify based on the name of the person, the license number, the state, the type of license, all the pieces of data they gave us, we still couldn't verify. 23% of their population, however, with our data, we were able to verify for them. They gave us the wrong data, but we were able to find the right license for them. And then 16% of their folks had expired licenses or certification. So what does that mean when you start thinking about the impact of that? So if we would go to the next slide, let's talk a little bit about what it actually means. So if you think about from an HR perspective or from a compliance perspective, if 13% of your staff didn't have the right credentials or the proper credentials, what would that mean to your organization? First and foremost, I think you would say or ask yourself whether or not the patients receiving the care really received it from properly credentialed staff, right? Did it impact the quality of the care that was being provided to your patients? You would also ask yourself, do you have the wrong name in your payroll system, right? Do you have tax implications, Social Security tax implications? What's been happening relative to potentially the wrong name in your system? You would also ask yourself, man, did I do an initial verification when the person was hired of that license or certification? And if I didn't, did I have a breakdown in my system? So now what's really happening, right? Is it a simple one person failed, to update their name on a license, or do I have a systemic problem? At this point, it really just means that you probably have more risk than what you realized. So when we talk about what actual risk is, these are just a couple of quick numbers that we monitor and pay attention to within our provider trust family. So the average OIG penalty for self-disclosure of an unlicensed employee. So if you think about, if I had an unlicensed person working in my organization and I self-disclose that to the OIG, the average penalty this year for self-disclosures is about $59,000. In 2017, the average was $53,000. So those are just averages that we've seen last year and so far this year. The second section speaks, I just wanted to share a little bit about what those largest penalties were so that we could see the magnitude or the type of exclusions related to license or certification issues. So the largest one in 2018, based on self-disclosure, was almost $250,000, and it related to an EMT that didn't have their basic certification. The largest penalty last year was about $188,000 for a home care nurse that had a suspended license. So when we think about how we're managing all of that data and that information, there are real penalties, not only to the impact within the organization, but to dollars that go outside. So remember, this information that we're talking about is just OIG penalties, right? It's not speaking to the internal expenses or other state penalties that might come about from that. So let's talk about some of that internal impact if our data is wrong. So right away, we have to conduct an internal investigation, right? If we see that we have information that's inaccurate, if we have potentially an unlicensed professional in our organization or someone with a suspended or probationary license, we have to kick off an internal investigation. we likely would be suspending an employee. So what does that mean? If we're pulling people off of the floor, we're suspending someone, that might create a staffing challenge, right? Do we have the right people to come in and take over that person's job literally in a split second? We also have to do a root cause analysis. We were just talking about whether it was human error or whether it was a system failure. So based on that, we have to know, do we really know the scope of the problem? What if it's a systemic problem? What if I'm a large organization? Do I have a problem within just one hospital? Is it in all my hospitals? In my world, I came from the post-acute. We had about 200 nursing homes. So I would be saying to myself, is it just in one of my facilities where I had a breakdown? Was it at my corporate office? Was it across the organization? So really understanding the impact of the problem itself. Then once I figure all of that out, right, I have to re-educate, because I have to make sure that we all know what the right process is. Was it a technology issue, right? Is there a system update that has to be made? And then, of course, the hard part is it a self-disclosure? What are the ramifications? Who else do I have to tell that this problem has just occurred within my organization? And then the last piece that we want to talk about in this area is specific to if it was a license or exclusion issue. So if we're looking at an internal impact for a license or exclusion, internal staff have to be instantly redirected, right, based on that sentinel event. If I'm surely not planning on that particular day to be dealing with an unlicensed person or someone that's excluded. So again, do I have overtime costs that are going to be accrued because I'm bringing in staff to fill the void for someone that I suspended? Do I have hourly staff within my compliance or my HR department who need to work overtime in order to help us get to the bottom of this? I'm likely now going to speak to my outside counsel to determine what potential penalties there might be, what sort of reporting obligations I have. We'll also be talking about, are there repayment issues? Do I have to reprocess any claims depending upon what that person's role was within the organization? So those are just kind of those very specific internal impact situations. And then there's those penalties that we talked about, right? So is there an OIG penalty, something that we have to self-disclose? Are there state Medicaid penalties? And again, repayment. So internal and external dollars in and both outside of the organization that are directly impacted by a license or exclusion situation.
So let's take a look at shared information and effective communication. So two parts to this. The first part is where the overlap is, right? So collaboration starts at the beginning. As it relates to HR and compliance, it's understanding from a mutual perspective, understanding state and federal documentation requirements, what's required from an HR standpoint and an ongoing sort of from a monitoring standpoint, and what's required from compliance to ensure compliance, right, as your organization continues to grow and scale. Creating compliance messaging upon hire is something that we certainly encourage and we've seen be a best practice in the industry. Monitoring licensing and certification requirements. What does effective monitoring look like as it relates to LCR? Is that a daily sort of activity? Is it a weekly process? Is it a monthly process? Understanding what's your risk comfort level, as well as what is efficiently good for your organization. Dissemination of code of conduct and employee handbook, and conducting background checks. So from a pre-hire standpoint, this is what we see from at the very beginning of the life cycle of an employee is an effective background check, which includes sort of the criminal side, abuse registries, exclusion databases, in addition to just basic credentialing and getting somebody into your network. And then once you've sort of gotten them into your employee population or into your vendor network or wherever it might be, it's the daily collaboration between these two departments. So how do you update and keep each other informed, staying current with regulatory changes and required messaging? What do disciplinary action reviews look like at your organization? And then the basics of just license monitoring, sanction monitoring from a state board level, And exclusion monitoring, is that a daily activity? Is it a weekly activity? And aside from just the process, when something happens in either of those worlds, right? If you find an exclusion, if somebody's license expires, what does the collaboration look like between HR and compliance at that point? And then some of the other ones that Donna touched on earlier in the presentation are just hotline investigations. Who owns those? And what's the collaboration between HR and compliance around them? Retaliation allegations, HR-related audits, as well as compliance-related audits, and then any sort of HIPAA issues that occur as well. And Donna, I mean, you can speak to this pretty well, given your experience from a compliance world. But talk to us a little bit about sort of the overlap between the two.
You bet. So when you look at kind of the pre-hire function, I think we look at human resources and kind of a point in time function, right? Typically, HR owns all of the pre-hire process. We look to HR to really be our experts in leading that initiative, making sure that all the proper background checks are done, license and certification processes are completed, proper documentation. Are there onboarding documents that have to be filled out? What kind of education has to be completed? Most organizations have a very robust orientation process for our new employees coming into the organization. So we really look for HR to kind of own all of the pre-hire requirements. But then once things start, right, once the employee is within the organization, then I think that changes and there's an awful lot more overlap between HR and compliance. We've talked a lot about the monitoring of licenses or sanctions and making sure that things are reviewed, making sure that exclusion monitoring is taking place. When you talk about training, one of the things that we did is really shared training requirements between HR and compliance and then all of the other organizations. And we worked to incorporate a singular compliance message into every single training that was conducted. So working with HR to say, what are the topics we're going to cover this year, working with the other departments and inserting that compliance message in there to try to make the training more robust and try to have a compliance message throughout at every opportunity. And then really working together on looking at the code of conduct. Things change over the course of a year and really looking to HR to help compliance see some areas that maybe weren't explained well enough in the previous code of conduct or aren't covered properly in the employee handbook or sufficiently, not really properly, but really working together to make sure that the tools that we're sharing with our staff have both voices equally shared within the organization. Then we want to talk just very specifically or explicitly about monitoring collaboration, kind of who does what, right? So license, sanction, or revocation, we typically see that those are kind of managed in the HR side. Now, the longer that I've been at Provider Trust, I will tell you that I'm starting to see, as Chris Redditch, one of our co-founders of our organization, will always tell us, when you've seen one healthcare organization, you've seen one healthcare organization. So we certainly recognize all the uniqueness of all the healthcare providers. But I would say we generally see that HR manages the license, sanction, or revocation process. So as you're looking at that and figuring out, are we collaborating? Am I doing it? Are you doing it? Ask yourself, who's going to own that, right? Who's going to oversee the responsibility? Typically, is HR notified first? When does compliance find out about that? Is the investigation completed? Is that led by HR or compliance? Disciplinary action, usually, obviously, that is managed by HR, but compliance will want to know, right, just to make sure that it's being done consistently. If it's a reportable event, that will fall in the compliance arena. So all sorts of opportunities in the license, sanction, and revocation to collaborate. Same with the exclusion process, right? How or what are you going to monitor and who's going to oversee it? Same question, right? Who's going to do it? Which party? Usually compliance identifies it first if they're managing compliance, or if they're managing the exclusion monitoring process. Certainly see many HR departments that own doing the OIG checks, if you will, or the exclusion monitoring checks as well. Who's going to lead the investigation? Is it going to be initially led by HR? Compliance, if compliance finds out about the exclusion, they're likely going to circle back with HR to find out a little bit more about the person, what role they have in the organization, how long they've worked there, that sort of thing. So HR is really going to have to share a lot of information for compliance to do that. Again, disciplinary action will be managed by HR, and then the reportable event will be wrapped up by compliance. But good examples of how important collaboration is between the two parties when it comes to license and exclusion monitoring.
And I'll jump in with one, we'll do one more poll question, is how often do you currently meet with your HR and compliance counterparts? We asked this for the first time in our last month's webinar and got really interesting results all over the board. This is one where we see really best practice is kind of unique to the organization. There's no right answer here, but it's just a, hey, what does this look like at your organization today? Is it weekly? Is it monthly? Or is it just when things come up, right? If there's a potential audit, if there's a special project, kind of what does that look like? We'll give it another couple seconds. Looks like most of us have voted. Go ahead and close it out. And just to go through the results again, right, we're seeing that this is pretty all over the board. So weekly is 17% of us meet with our either HR or compliance counterparts on a weekly basis. 22% of us meet monthly. 10% are just for special projects only. The majority of us, 40%, have no routine meetings with our counterparts, even though there's quite the baseline from a data perspective. And then 12% are other. So I would imagine this to be either more frequently than weekly or less frequently than monthly. Just getting better together, right? Last slide in this section is what we would encourage is how do we develop a culture of leadership that has purposeful collaboration, the recognition of the importance of both roles, transparency during investigation, and monitoring metrics together, right? Turnover, onboarding statistics, complaints, employee satisfaction. As we've looked sort of kind of what does that look like as it relates to data now? So kind of the next section we'll go into is how to design an effective data monitoring strategy. And then we'll leave you with an action plan so you can take this back to your organizations. But just before we jump in, remember that what we anchored to from a data perspective earlier in the presentation was baseline people data and then sort of tier 2 of people data that's unique to your organization, specific requirements, specific trainings that are unique to your system or your facility, either on a location basis or by job title or kind of whatever specificity makes the most sense for your organization. Now we'll look at how to actually put that into practice. So let's start by just sharing a little bit about healthcare is predictive. We see this all the time with onboarding clients and from our ongoing monitoring services that we leverage is really here's the line. That first bullet point is we see it happen all the time. State sanctions predict licensure issues, which predict OIG exclusions, right? The typical workflow and the life cycle of an exclusion starts from a state sanction. So, right, state licensing board in Kentucky issues a disciplinary action against a licensed provider. As a result, that provider's license is suspended or revoked, and that license revocation ultimately leads to an OIG exclusion. It's a very common pattern. So we see it all the time. As a matter of fact, about 43% of all exclusions at the federal level have actually come and resulted from a licensure issue, right? There's just a direct correlation. So when we say healthcare is predictive, we really mean it. Sometimes monitoring state sanction boards for your employees or for your provider populations is actually the best way to predict future licensure issues or even future exclusion issues as well from a compliance and an HR perspective. Hotline calls predict a brewing problem in a particular department or location. We see this all the time. I'm sure if you have a particular question about what best practice looks like, Donna would be a great resource to reach out to and say, how do you actually leverage hotline calls and how do you predict trends as it relates to hotlines? Increased turnover is a predictor of so many areas: quality issues, lack of support. We certainly see that. That's not unique necessarily to healthcare. We see it in other businesses as well, but certainly it applies within the healthcare space too. And a decline in employee satisfaction predicts a potential leadership issue. This is kind of outside the scope of people data, but as it relates to people data, is collecting satisfaction data within their specific job title or job roles or responsibilities or organizations. It's a great way to understand what's happening within your organization. HR and compliance collaboration is key to monitoring these predictive metrics and working together for early resolution. Can't emphasize the first bullet here enough, though, which is sometimes if you can catch the right things at the front end, it's the way to catch things and stay ahead of things that could happen on the back end. If the healthcare tells us anything, it's that finding those right metrics from a people standpoint first and early help prevent so many problems down the road. Communication is key, right? There's no secret here. Collaboration between HR and compliance is essential. What we would recommend is to jointly identify potential risks or weaknesses in current processes as it relates to that baseline of people data and monitoring. And then ask yourselves if you've documented all the license or certification requirements of each position. What's that gap analysis look like? And ask yourself, when's the last time you actually verified these requirements were still valid? Are the same rules you put in place months and months ago still certainly applicable? Really, HR and compliance have lots to share. There's a lot of systems that exists between these two departments, whether that's an LMS or training metrics, dashboards as it relates to compliance, license monitoring, exclusion monitoring, or sanction monitoring. The opportunity for all of us is to say, how do we take that data and leverage it to be actionable? Here's just a couple of did you know statements that I think really just summarize some of the predictive nature of the healthcare industry. Right? Did you know that 43% of all OIG exclusions are due to license revocation or sanctions? Just mentioned that, but there's the actual statistic. There's over 200,000 total exclusions in the universe today, right, as it relates to the United States healthcare system. 70,000 of those are on the OIG. Another about 70,000 are state Medicaid exclusions as well. And as per the Affordable Care Act legislation, if you're excluded in one state, you're excluded in all. Over 56% of the state exclusions are actually not in the OIG. States are required to report exclusions to the OIG level. What we find is that almost half of the exclusions that end up in the state level actually never make it to the federal level. And it takes an average of 173 days for a state exclusion to appear on the OIG exclusion list, right? States are required to report to the OIG, and they're required to do so timely, really within 30 days or so. What we see is when it actually makes it there from a state level, it's taking about 173 days, right? So about half a year to actually end up on the OIG. So what we would recommend, right, is to conduct a gap analysis of your requirements at your organization that are specific to you, and see what you should have versus what you do have. Here's one that we did for a client, and you can see kind of what, in running their data through, what we were able to find. And the results are actually pretty typical and scale with size. So the percentages typically remain true even though we see clients in varying sizes. So we did this for a large post-acute system with about 85,000 employees with facilities across 45 states. The client services, and just a little bit of background, is their skilled nursing and rehab, long-term care acute hospitals, home health, hospice, and inpatient rehab in terms of the types of facilities that they have. What we activated for them, we activated continuous exclusion monitoring. We implemented a proprietary data service to determine the completeness of that demographic data, that people data baseline. We activated continually license monitoring and verification across all 50 states, and we designed for them a custom requirement policy unique to their job titles, job codes, and HR standards, right? So certainly that's a little bit about what we do, but what we found in doing that within the first 30 days were immediately 12 exclusions discovered, $1.2 million in potential exclusion fines avoided. And here's the big one as it relates to data. 30% of licenses that they sent us had issues across the entire HR organization. Either they were expired, inactive, revoked, had a state sanction associated with it. That is the metric that if there's one thing I would take away from this entire presentation, I would take away the number 30%. 30% is typically what we find when we work with clients and help them do that should have versus do have analysis. We see that there's a 30% gap typically, which means between everything you say you should have for that's unique to your organization and your specific job titles, right? The RNs that work at your systems, the physical therapists. What we typically find is there's about a 30% delta there in what you should have based on what you define as your requirements versus what you do have, and the ones that you do have being active, valid, and having no issues. So I'd recommend just doing this exercise. I think you'll find a lot of value in it, and I think you'll actually find some gaps in the process from an HR and compliance standpoint. So as we close today, it's how do you actually do this? What are the actionable steps to actually build a strategy? Building an effective data strategy, right? An effective data monitoring strategy addresses these core risk and operational issues. The problems that you will run into just on the front end to try to address them would be time, coverage, cost, risk. Is this scalable, and is this actionable? Right? And here are some of the solves that you associate with some of these problems, right? So from a time standpoint, how do you find a process that is an effective people data strategy that's automated? It's hands-off, it's not manual. Coverage, right? What's your risk tolerance across the shared functions between HR and compliance? From an exclusion standpoint, a sanction standpoint, and a license standpoint, what's the tolerance of risk that you're willing to take on as it relates to these processes? Cost, right? Eliminating manual work. How do you take hours out of the day that are associated around data monitoring and actually automate some of that to get dollars back, right? To increase efficiency for your organization. Risk. Is there a way to do so and transfer your liability at the same time? Scalable is how do you scale a solution from just your employees to your referring network, referring physician network? How do you take a solution for your vendor population and scale it to the owners of those vendors, right? That's what we mean when we say scalable. And then actionable, right? How do you get rid of the fuzzy matches, right? The things that you're not sure, is this really the same John Smith that exists within your organization? How do you take immediate action to actually take the data you have from your processes and make it actionable for your compliance or HR teammates? And so where do I begin, right? Here is the action plan. And it looks like we actually have one more poll question before we get into this, which is which department handles license management at your organization, right? The last poll question for today. So really, we'll end it out with this. Is it compliance? Is it HR? Is it a combination of HR and compliance? Or is it some other, right? So is it IT that's running a script in the background? Is it legal or risk or internal audit? Maybe it's SIU if you're a health plan, right? Is it credentialing, right? What department handles license management at your organization? We'll give it another couple seconds. Looks like most of us have actually gone and voted. So thank you again for your engagement today. And we'll share the results. So most of us, it's actually 41%, and that's pretty consistent that it's a function that's exclusively owned today by HR. 10% of us, though, it's owned by compliance, and it's not owned by HR, which is interesting. 34%, it's a combination of HR and compliance, which makes a lot of sense and certainly is what we'd encourage today. And then 15% is other. Maybe that's IT or maybe it's credentialing. And so with that, let's go ahead and dig into the why begin, the fun part of the presentation, which is the action plan. Step one, here's what we would recommend you all do today if you have the bandwidth, and we'll try to end the webinar maybe 5 minutes early or so you can get started on this. Identify the people data baseline at your organization between HR and compliance. What are those commonalities that's the baseline of data that apply for everything HR needs to do and everything compliance needs to do? So question one, right? Does your company have an aligned people data baseline? Is this something that exists today? If you hire a new employee, what are all the data points that you need on that person to sufficiently execute your compliance and HR strategy? Right, a couple of sub questions here are, what are the specific demographic data points you collect on each employee? List them out, right? I would list them out and gut check yourself and see if it's still accurate. Are any population groups treated differently, i.e. Potentially referring physicians without social security numbers, right? Do you collect that on everyone? Do you collect NPI on certain on physicians or vendors? Do you collect NPI on owners of vendors? Where is the data stored and maintained? I would again list out the systems. What we see is every single healthcare organization does this differently, but also I've not seen one healthcare organization that has all of this data in one spot either. So it's a good exercise to go through and just say, where is all of this? Where does it live? How often is this data validated and or updated? What LCR information are you collecting by person, job title, and location? Is this a known and aligned strategy throughout your company? Go ahead and step one is answer those questions. Once you have the answer to those questions, it'll inform you on how to proceed in step two, which Donna will take it away.
You bet. So in step two, as we continue our gap analysis and we go back to what we were talking about earlier about that quote should have and do have documents. So sit down and try to identify all the necessary documentation that each employee has to have based on their job role, right? So a nursing assistant versus a nurse versus a housekeeping person or a laundry person, a business office person, right? They all have different roles and responsibilities. So think about what are those things that each of those different roles would have within your organization, and be location specific, right? If I'm in a different state, or if I'm in a different probably just state, right? If I'm in a different state, I might have a different requirement. So make sure you don't forget about the location. Then identify what is that total number that's needed per person. Make sure that you know each role, each person. Then do the gap analysis. See if you have any holes. Does that person really have those 5 things, or do they only have 4? Do they have 3? Or, oh my gosh, they have 5, but 2 of them are expired and we didn't get the new license number. And then ask yourself, is it process driven, right? Are your gaps a failure in your process? And how can you figure out the best process to resolve that? What kind of current resources do I have in order to improve that process? Dave, what's the next step?
Step 3 is to remediate the gaps, right? It's to begin the process of starting this. And really specifically, it's how do you start with LCR requirements? So what are the things you need, and then how do you solve that gap? Based on your internal requirement policy, how compliant are you? What is that percent? What we typically see, it's about 30%. What's it for your organization, and how do you put a number to that in terms of risk? Are there particular job titles, locations, processes that seem to have the largest trends and or gaps? As an example, if you're a physical therapy organization, are you seeing your physical therapists that are from a particular state having the most gaps in terms of this LCR requirements? Or if you're a post-acute system, is it your RNs, right? We know that the majority of exclusions are actually resulting from RN licensure issues. So is that something that you're seeing as a trend within your organization? And then delegate the responsibility to your teammates in HR and compliance to solve for the gaps, given different processes, functions, and requirements, right? So to quickly recap where we are so far, step 1 was to identify the people data baseline that everyone needs. Step 2 is to conduct that gap analysis between the should have and the do have. Step 3 is to remediate those gaps, and to do so as a joint responsibility between HR and compliance. Donna, take it away with step 4.
And step 4 is really bringing it all together in the alignment between both parties, right? So really, as you're looking towards how are we going to improve this process, looking together between HR and compliance, designing your monitoring needs for the people data and the alignment that you have, right? What are our next steps based on what we've seen in our gap analysis, based on the data that we have available to us? Then ask yourself, do we need to invest in internal resources, or are we at a point now where we probably need to look to a partner to assist us in this process? And really ask yourself, what's your level of risk tolerance, right? What are we okay with? I think we all recognize that 100% compliance is where we want to be, but probably at times somewhat unrealistic. So what's our level of risk tolerance? And in that we would include, the dollars and the hours of the man hours that we have to put forth in this effort. So what's our level of risk? And then what's an effective requirement policy look like? So when you're all done, you've identified your risks, you've figured out what those gaps look like. What does it look like for you going forward? And you together, as two very important departments, must collaborate and agree on kind of how we're going to do this on a go forward basis. And I think Dave's going to wrap us up with one final slide about provider trust and how we can help.
Yeah, just step 5 here is ask for help, right? So call us if you'd like any more data on this to better understand it. We live in this world, so we are certainly here to help. And then call us if you like help in actually action planning to eliminate those gaps. What does that look like? What are other organizations in your space doing? We work with the post-acute world, the therapy world, the acute systems, right? So we've got some experience in understanding how to put this plan into motion, and we just love helping people. So if you've got any questions about that, please don't hesitate to reach out. So with that, kind of we're wrapping up for today. We have a few questions that have come in, and I don't know if we'll have time to get to everyone, but we might hit 1 or 2. Again, if you've got any questions about how to put this plan into motion or any of the data that you're seeing from a requirement policy standpoint, feel free to ask us in the panel. If we don't get to your question today, we will we'll certainly follow up with you one-on-one. This question, first question that's come in is from Cassie. So Cassie is asking a question specifically about exclusions as it relates to referring physicians. So her question is, are unique, some of that baseline is baseline people data, right? I'm interpreting here. Things like social security numbers and NPI numbers, are those published at the primary source for exclusions? It's a really good question. So Cassie, thanks for asking. The answer to that is actually largely no. So if you go to the OIG LEIE right now and you try to verify an exclusion, it'll ask you for that social security number so you can verify yes or no, is it the same person at the primary source? But if you download that raw data, so if you're not doing this just on a one-on-one basis and you're trying to do this at scale for large organizations or for the masses, you can download the OIG's list, right? The list of excluded individuals or entities. If you download that raw data file, it does not, right, and rightly so, it does not include things like social security numbers or unique identifiers like that. Those are, you can only go directly through their sort of interactive search function on their website to verify with a social. You don't actually have that ability if you're downloading raw data. And then on the state exclusion side as well, very few state sources publish any sort of social security number or NPI data as well. Kind of what we do on the back end is we take exclusion records and augment them with NPIs or socials so that we can better help our clients. But largely, you cannot see that data at the primary source. Donna, here's a good question for you. So this is coming in from April. With state licensure compacts, are you seeing increased or decreased sanctions in those professions that participate? Really good question, April. Thanks for reaching out.
You know, that's a really good question. In fairness, I don't know the answer. That we've seen an increase. I'd say we've seen an increase in the volume of people with compact licenses, but I don't think that I could say that we've seen more sanctions for the people with compact licenses. I'd say that people that have sanctions tend to hop between states that don't have compact licenses because it's easier to get ahead of that than it is with a compact license.
Yeah, Really, really good question. Guys, it's 12:57, and we promised you this would be less than an hour. So we do have a couple questions that have come in. We will absolutely reach out to you guys from a one-on-one and just make sure you get the answers to those questions. So stay tuned if you asked one and we didn't get to it today. Guys, thanks again for joining the session today. As a reminder, you will get today a copy of the recording and the slides and have all of this. And for sure, if you have any other questions, just feel free to reach out. We're always here. Thanks so much.